So I'd like to introduce our next speaker, Bethany Shum.
Yes, thank you, Lucy, for helping me press. I think it's really nice to have such a huge interest in circus medicine, because that certainly, it felt, at least that didn't felt like the case when I started to become a physio a long time ago. So I'm really sorry for the super long title. So I thought there's too many keywords. I'll just put my name there so you know who I am. So next slide, please. So I'm just going to set the scene a little bit. Had anyone seen the circus show before? If you do, raise your hands up. So like, what if, oh yes, fantastic, everyone. Who hasn't raised their hands up? Oh, sorry. Just kidding. Next slide, please. So when you watch a show, have you ever think about are those people, how did they not break themselves, or how did they not get injured? Yeah, there's a lot of nods in here. But the reality is they do. And when they go see a doctor, can you do next slide, please? They might tell them that you might need to stop, so you could be an aerialist. It's meant to have a little video, but I don't think it works, so we'll just carry on. Next slide. It could be with the sleigh, some professional settings. Or I've had in cheerleading, because that's my background as well. It's very acrobatic based, so lifting people. This is meant to be like a video, but again, sorry, technical issues. Oh, okay. There you go. So this is a hand-to-hand. So I think the difference between acro and cheer, we wear shoes, and people in acro, they do a bit more toe gripping. And going into a QP, single hand. So as you imagine, the injury risks are pretty high, but because there's no research to kind of say what's happening in the industry, then it's really hard to know what to work on and what to look into. Thank you. Next slide, please. And then also adding, because did anyone see the poster while you're in London? There's this swan lake acrobatic thing. So I mean, performing artists, dancers sometimes can get into learning acrobatic skills as well as part of the performances. Next slide, please. So that has led to my research. So I did this research 2 years ago when I was studying performing arts medicine at UCL. My background is a pain specialist physio, and I do acrobatics, circus. So I was trying to find ways to combine those two together. So like most research, we started looking at where do people get pain, how do they talk about the pain, and what's happening within that world. So we found that in the performing arts industry, in the circus particularly, mainly people would describe their pain as injury related or performance related. I'm aware this is probably a bit more of a layman term, but this is the lens that we're going to go with my research. So next slide, please. So the research looked at London-based acrobats only for and then look at in London what's happening, because I'm aware that other countries might have some papers looking at the US and Australia, but there's nothing in the UK, so I'm like, yes, I'm going to be the first one. Next slide, please. So in this research, we define acrobats as people that do this sort of discipline, so circus performers, gymnasts, and cheerleader. So I guess it's mainly ground-based, but there are people that might do aerial art that's included in the study population as well. Next slide, please. Like most research, it's really difficult to do it by yourself if you've done research before. So I'm very lucky to have great supervisors from UCL, so Isabel. She helped me a lot. And in terms of distributing the research, BAPAM has helped us. National Centre of Circus Art is also where I work as a physiotherapist there. They helped us as well. And lastly, we've got Mimber, and the female-based acrobatic theatre company. She also helped us to distribute the research. And I'm very grateful to say that she's actually in the audience here supporting us. So, oh, everyone's clapping. Okay. Lovely. So next slide, please. So the research is done over a period of time. I think it's about 3 months using validated questionnaires, and we gathered some baseline demographics such as where are the pain location, what caused the injury, and then I think the main thing that I haven't really seen other people doing is kind of the impact of life. As a pain physio background, we know that actually we can't separate the physical and emotional elements of pain. If you address one, you need to address the other, because you can't separate them. And pain is really complex. You sometimes will have an injury, but you might not feel the pain. But sometimes you had huge pain, but you actually don't have an injury. So our perception of pain and our sensory experience of pain can really change depending on the context. depending on how we perceive it, our experiences, so many like biopsychosocial factors. Next slide, please. Oh, and that's me. I thought I would do a bit of like, so just to know that I did do acro. So the questionnaire we use is called the McGill Pain Questionnaire and also the FAST scale. So people in the medical industry probably are quite used to these type of ways to assess pain. So the reason we do a McGill Pain Questionnaire because it identifies the bodily location. It also has the sensory aspect of like how people kind of describe pain as well in the body. So it will kind of give these words about like, is the pain throbbing, achy, impactful, so that it kind of measure the impact a bit more rather than like 10 is the worst pain, but 0 is not. But I still need to do this, unfortunately, otherwise it's kind of difficult to compare results. So if anyone have any smart ideas to do it differently, please, I'm open to suggestions. Next slide, please. And the other thing that we measure is Pain Self-efficacy questionnaire. For people that might not be familiar with this term, it's kind of a mouthful, but essentially you're measuring the ability to carry on with pain, activities despite pain. So are you able to work despite pain? Are you able to, does pain affect your everyday life, your everyday activities of daily life? Does pain affect your hobbies, leisure, so on and so forth? Next slide, please. So we sent out this questionnaire. We had 93 people answer it. And within that, everyone completed it, but there are some people that did not experience pain in the last 12 months, so they're excluded, and end up with 88 participants for us to analyze the results. Next slide, please. Oh no, back, slide before. Okay, sorry, because I want you guys to have a little guess of the result rather than just like giving you the answer. But so we look at the area of the body, which in my population of where's the most common location of pain and where's the common location of injuries. So I know normally if I ask people to raise their hands up, they're just like, so what I'm going to do is ask if you don't have any shoulder problems, I want all of you to raise your hands up. So if you think that shoulder pain is one of the most common site of injury, put your hands down. I'm just going to keep it up. Yeah, put it down if you think it's the most, dang, you guys are good. Okay, same again, hands up. If you think that back pain is the most common site of injury, put your hands down. I'm just doing it up, doesn't mean I'm right. Okay, so I felt like actually most of you are kind of on the right track. Sorry, Lucy, now you can go to the next slides. So the findings show that most of the people that participate in this questionnaire is female, and most of them are white British, and I guess it's because of the nature of the people. Well, we're in London, so likely that's why we get these results. The most common age group is quite young. I'm guessing because when we send out the questionnaires, like a huge portion is people from the National Centre of Circus Art, so you're gathering a bit of younger population as well. And what I thought it was interesting is that I don't know the actual data, but in circus art generally it's quite female heavy. Like in the school that I work in, we have more females. When I do acro myself, again, it's a lot more female than male. The average duration of training, I thought I'll put it there because it does vary. So it's quite, some people have, do about 3-4 hours, 5 to 6, but some kind of go up to 7. So it's kind of hard to find patterns between like, how long training and the relationship with pain. But I thought that would be an interesting thing to look at. Next slide, please. Okay, so the location of pain, you kind of guessed it. So the most common injury site, it's shoulder followed by back pain, but the common source of pain is actually reverse. So they might get back pain more frequently, but not necessarily injury related, and then next is shoulder. And it's kind of 50-50 how they define as performance related or injury related. Next slide, please. So this is the type of injury that they kind of say what they sustain. So repetitive strain ligament sprain, really similar to what we're finding in the literature. Next slide, please. So if you are kind of stats heavy, then you take a picture. If not, we move on. Essentially, this is just saying like in the research, the injury group and the non-injury group, what are the scores in terms of the pain and the impact of pain in the pain questionnaire. Next slide, please. So I thought this is the interesting part. It took a while to make this correlation, but what we found in this study is that there is a correlation between the pain scale and also the PSCQ score. And what we also find is if you have an injury, you're more likely to have more pain, and also as a result, you're also more likely to has a higher impact. So if you have more pain, likely injury related, and then you're likely to have a higher impact on their quality of life and the activity of daily life. What it's also really interesting that is, if you look at the numbers here, this is the PSCQ score. The higher the score, meaning that they're more likely to push through and carry on. So in this population, there's actually a huge group of people that are pulling towards, yes, I have pain, but I carry on. I thought that was quite interesting. Next slide, please. So, in terms of the finding, I think it just kind of validates the fact that injury is quite common. You probably see a bit more shoulders and back in the acrobatic population. And behavior-wise, we often might find that people will push through despite of pain. And I think it will be really helpful to have a little bit more understanding of how we can prevent this injury and manage this pain better in this population. Next slide, please. Like most research, there's limitations. So the data set is carried out in quite a short period of time, and so it will be quite different if you look at in a bigger scale. And also, we didn't actually look at the subcategories of different circus disciplines. So when I was doing this research, I think after designing the study, then there's a new consensual statement of how you categorize circus in research. So because that came after when I was designing the study, so unfortunately we're not able to do that, because that would be a really interesting research, right? To understand like ground-based and the difference between like an aerial kind of air-based results. Yeah, and I think the last thing is like pain is really difficult to measure at the end of the day. It's so subjective. So it's maybe potentially thinking about focus group. Maybe that could be something that might be quite helpful to understand a bit more how the conversations and like the thoughts and feelings within people who have pain and injury in the circus industry. Next slide, please. In conclusion, pain and injury are prevalent in this population, and it would be nice to do more research to understand injury prevention technique, training load, and a bit how do we work on psychoeducation to help our performers, circus artists, to do the best they can without worrying about pain, injury, and having to stop. And that's me again in the corner. Next slide, please. This is the reference. Next slide, please. More reference, sorry. More reference. It was hard to do the font, and thank you. And I just want to say thank you for everyone that helped me, because, like I said, without these organizations sharing the result, I don't think I'll get 88 participants. Like my friends do acro, but not that many are injured within, I need a lot of friends to have 88. Next slide, please. And yeah, get in touch with me, chat with me if you've got any questions. More than happy to answer questions from my perspective, my experience in dealing with pain and injury with circus art.